Cisco
Henderson,
and right now
Yes.
Drake,
we are going to be watching
Assembly Bill 189
Wisconsin
passes
State
15-0.
legislator discuss.
With that,
Assembly
we're
Bill
moving on to
465.
Assembly Bill 465. Ledge Council, please briefly summarize Assembly Bill 465.
Assembly Bill 465 specifies that a healthcare provider may not provide gender transition medical services for a minor or make a referral for the services. The prohibited practices specifically include puberty blocking drugs, hormone therapies, and surgeries that are identified in the bill. The bill requires the medical examining board, the board of nursing, and the physician assistants examining board to investigate any alleged violations of the law. And if it determines that there has been a violation, requires the board to permanently revoke the person's license. The bill lastly has a 6 months delayed effective date and a statement of legislative intent stating that the delay is intended to allow for tapering and discontinuation of puberty blockers or hormone therapies.
All right, thank you. I'm looking for a motion and a second. A motion by Representative Gundrum and seconded by Representative Sappick. Any discussion on Assembly Bill 465? Why is it I knew we probably would on this one? I'll start with Representative Subek.
I'm guessing maybe you knew we would have discussion on this because you knew what a bad idea it was. Here we are after having a hearing where we had countless folks come through and talk about their own personal experiences and how this bill would negatively impact them, their children, their families. We heard from medical experts who are opposed to this bill because it flies in the face of medical recommendations and medical science.
No, it doesn't.
We heard from both physical and mental health experts about why this is wrong for the health of our youth. This is a bill that is politically motivated, and Republicans are using our most vulnerable youth as pawns in a sad political game.
No.
And it is incredibly frustrating to be here again talking about this. I had hoped, naively, of course, after the hearing, that perhaps you'd hear the kids out, perhaps you'd hear families out, perhaps you'd hear medical experts out and realize just how wrong this bill is. Its very presence is creating a hostile environment to youth who are already some of the youth who are most at risk of mental health crises, youth who are most vulnerable to suicidal ideation, youth who are lost every day in this country to suicide. We should be there supporting children and families, treating them with dignity and respect, allowing them to be their authentic selves. But more importantly, as importantly, I should say, we should be listening to the medical experts. This is a terrible example, and we do this all the time in this country, where legislators, and particularly Republican legislators, intent on governing individual decisions and individual access to medical care, decide that they know more than the medical experts.
Yet,
and I read this list in the hearing. I'm just going to run through a few of them again. Folks who are opposed to this bill: Children's Hospital of Wisconsin, experts in children's medicine; Medical College of Wisconsin; National Association of Social Workers, a group of mental health experts; the Wisconsin Association of the Local Health Departments; the Wisconsin chapter of the Academy of Pediatrics. Who do we go to when we need care for our children? The pediatrician. You don't go to your politician. You go to your pediatrician. Yet somehow Republicans in this building think they know better than the pediatricians. The Wisconsin Medical Association, our doctors, oppose this bill. The Public Health Association. We heard from the psychologists at the hearing. I'm not sure if they were registered yet when I printed the list from our website, but they clearly came and testified about why this is bad for youth mental health. Let's show respect to every single individual in the state. Let's stop interfering with their access to the medical care that they need. It's time to stop pretending that politicians know better than physicians and know better than experts. We don't. Let's reject this bill and do what's right for families and particularly for trans youth in this state. Thank you.
All right, I think Representative Vining had a question or statement, perhaps.
I do have a statement, Mr. Chair. Thank you. It is World Mental Health Day today. And we know that the mere introduction of this bill causes harm to the mental health of the LGBTQ plus community. So I want to say that I am really grieved at the introduction of this bill, and I will go farther and say that I am really angry about it. Wisconsin kids and their families deserve to be treated with dignity and respect. We should be here affirming human dignity, but we are not. We should be here respecting Wisconsin kids and the healthcare decisions that they're making alongside their doctors, the experts, but we are not.
Painful.
I want to be clear that the legislature is failing Wisconsin families with this bill.
No,
This bill does not help. It harms.
It doesn't.
To the LGBTQ plus community, I want to say, I am sorry.
Oh.
What is happening here today is wrong.
Oh my God.
You deserve better behavior from your state legislature. You deserve to be treated with dignity, and you deserve to be treated with respect.
Performance.
What is happening here today is wrong. I also want to say thank you for sharing your voices last week. Thank you for being here.
I was there.
Thank you for being who you are.
We're
We
gonna
did hear you.
Those voices.
Your voices will stick with me for the rest of my
They will
life.
stick with me for the rest of
Your
my
voices, your stories,
And
and your bravery to share them did make a difference. And there are people who are in this building who will fight for you every chance we get.
We will fight.
You are not alone in the Capitol. We are here with you. We stand with you. You are loved. You are valued. We love you. The vote is no.
All right, Representative Drake.
Thank you, Mr. Chairman. There's a quote that goes along the line of those closest to the issue probably know the solution to the problem. For those that, are part of Best Day for the Whole committee, we had a lot of emotional testimony. And when they dropped off the stack of testimonies, I had my staff, which we must love our staff because they are ride or dies.
Yes, I saw
I
them.
had them count
Stack. All of the
how many
activist
people
groups, they dropped out
testified.
stacks of testimony.
There were over
Whether it
350
was
people
Planned
that testified
Parenthood
that day.
organized groups,
And the vast
Wisconsin
majority
Fair
of them
organized groups,
shared how this
the
would harm them.
ACLU Wisconsin organized groups.
And it
Yes,
wasn't
every
just the youth, it
leftist
was also the
activist group went
families,
around collecting
the
testimony and
parents that
dropped it
shared
off.
how this would impact
They
their
are
lives.
very good at what
And I
they're
believe as a
paid to do.
legislator, we do our best work when we listen to people that actually impact them. And so for this reason, I don't see in good conscience how we can support this bill. The vote is no.
All right, Representative Reamer.
Thank you, Mr. Chair. I'm taking my 2-year-old daughter to a doctor's appointment later this month. Taken her to doctor's appointments in the past, taken my 5-year-old son to doctor's appointments. And fortunately, they're pretty healthy, but we discussed with the doctor what we can do to make sure they stay healthy, that they address problems that they've been facing or they might face. And so I guess I think of issues like this as a parent. I wouldn't say I do that for every issue. And when parents come and say, my child was thinking about taking their own life for years in some cases, but through extensive conversations with a number of healthcare professionals, trying to figure out how to deal with that. I mean, I could only see it through the lens of what would I
The same are
do
transition
if this
the
was one of
kids,
my kids?
Sperm the kids, or they will kill themselves.
And when it comes to those
Please,
conversations
come on.
with doctors, tough
These kids will die, these
conversations
kids
in a
will
lot of
kill
cases,
themselves.
certainly
They're going to kill
those
themselves.
sounded like
If they
incredibly
don't
painful
get
and
this
difficult
care, if they don't
conversations.
get the
I want
steroid blockers and the cross-sex hormones, and
every
if they can't remove
option
their
to be on the
genitalia,
table.
they're going to kill themselves. This is
And I want
that's the
doctors to
mantra.
tell me
There's
what they
I
can do
don't know
to
when medicine is
make my
operated
kids
under the
healthier or even
blackmail,
save their lives.
basically
That's
the emotional
really
blackmail
what is going
in
on.
order to
So I
receive
think
medicine.
just
In any other
this bill, which
situation, I don't
again,
know
the
when that
intent
was
behind it
considered okay and best practice,
troubles
but
and concerns
apparently
me.
now
I
it
don't want
is.
to
And I think there'll be
impute
some
too
more
many
data on that
negative
at
motives
the
on
end
the
of this.
authors who put this forward. But even outside of that, just on a practical level as a parent, for whatever the future may bring, I want as many tools in the toolbox to keep my kids healthy and safe and keep them alive, and have those conversations with doctors and people who do this every day and think about this every day and work on this every day and understand the medical and ethical implications of what this means. Not politicians like me, like us in this room.
I find it
So the
hard
vote is a no for me, and I hope
to
you'll
hear
join me.
feel
Thank you.
okay if taking their 2-year-old or
Any
5-year-old
further
daughter with
discussion on
autism and
Assembly
several
Bill
other
465?
comorbidities, any child with several
All right, I
comorbidities
will
to
save
a
my
doctor
comments
and
for the
have them
floor.
immediately, within 1 or
I'll
2
ask the clerk
sessions,
to call the
affirm
roll on
that they
passage of
are
AB
that they are born
465.
in the wrong body
Moses.
and
Aye.
we're going to give them
Rosar.
drugs
Brooks.
that have a lifetime
Summerfield.
of devastating
Murphy.
consequences in order
Dietrich.
to
Gundrum.
make sure that
Vandermeer.
they feel better
Magnifici.
about themselves
Sapek.
in the moment. I
Stupak.
struggle to believe that
Reamer.
that would be an okay
Vining.
thing for these guys.
Anderson.
No.
Drake.
Assembly Bill 465 passes 10-5. That is the adjournment of our executive session today.
Passes 10-5.
So without objection, we'll recess the executive session in case members need to record their vote. The executive session is adjourned. All right. I will now ask for unanimous consent to carry over the roll for the public